So for instance, take a look at CAT scans. Let's talk about stroke. Stroke is one of the leading causes of disability and death in the world. You're young, I'm young, your audience is largely young. If you're over the age of 25, keep listening because 1 in 4 of us will suffer a stroke at some point in our life. That's tremendous. And the problem today is very few of the patients that are suffering stroke are being treated appropriately. Time is brain, seconds count. You lose 2 million neurons every minute a stroke is in progress. But if we can get you to the interventional suite, to our Azorion, and to an interventional neuroradiologist or neurosurgeon or an image-guided therapist, they can navigate a tiny catheter to the brain, to your middle cerebral artery, and take out that little tiny clot and potentially reverse that stroke if it's done early enough. But that's the key, to get it done early enough. And so right now we have solutions where we are speeding up that time to brain so that patients don't have to go, for instance, to a CAT scan and then wait for that CAT scan to read, a radiologist to read the image and then call all of the team that needs to transport that patient to the stroke center. We can shave off lots of those steps using AI. So for instance, a CT scanner can automatically scan through that CT as the patient is being imaged for stroke. And it's sort of an early warning system. If it thinks that there's a clot that's amenable to thrombectomy, it'll automatically activate all of the people that need to respond. So now you're shaving off time. So that's one example of how AI is making a difference. Speeding up imaging, MRIs, Smart Speed, which is a technology built into our MRI scanners. We now can scan patients 3 times faster with 65% more resolution using AI. So if you've ever had an MRI, you know how sometimes uncomfortable it is to sit there in that scanner. You can do it 3 times faster using AI. Or with cardiac disease. It used to be if you go to the hospital, and it still is, a nurse would have to come and check on you every 30 minutes, checking your vital signs, checking your heart rate and your blood pressure and so on. But now AI is being embedded into our patient monitors, and even wearable biosensors can monitor your vital signs, not once or twice an hour, but once or twice or 10 times a second. And so it can crunch all of that data and then predict who's at risk for a cardiac arrest before you have that cardiac arrest. And in fact, one hospital in the UK was able to reduce cardiac arrests by almost 70% using this technology. So the trick for AI, I think, is making use of that mountains of data and helping us intervene before something goes wrong rather than for waiting for it to happen.